Greetings and welcome to The View from the Summit. This is Gene Tyre. Thank you for taking time out of your busy schedule to tune in to our program today, and I hope that you're going to find it very, very helpful. I've got some good news for you. When you have a problem, a physical problem with your hand, your wrist, or your elbow, it's not necessary for you to go to Atlanta or to go to Columbus or any other city for treatment. Right here in Newnan, Georgia, and in Coweta County, we have the finest rehabilitation center in the entire United States, and it's known throughout our land as one of the finest. Russ Foley is the consummate professional, and one of the reasons why the Georgia Rehabilitation Center is so successful is the professionalism that Russ brings to the center, but also the tremendous support team that he has here, composed of some of the outstanding physical therapists. And today, I am so fortunate to be seated between two of the finest. To my left is Kim Shelnut, and to my right is April Johnson. And Kim and April, I want to take this moment to welcome you to The View from the Summit.
Thank you. Thank you.
We are delighted that you have taken time to be with us today and to share some very, very helpful information with our viewing audience. We want to say a word to our viewing audience. We want to assist you in improving the quality of your life. And these two individuals that are our guests today, Kim and April, are going to be sharing with us some very, very important information concerning the therapy of our hand, our wrist, and our elbow. So we're going to be talking about different diagnoses and the treatment or the therapy that you prescribe and how you're going to be sharing that treatment with us. So let's talk about some of the different diagnoses. Let's talk about, first of all, carpal tunnel syndrome. I know that you see a lot of patients with carpal tunnel and who've had surgery for carpal tunnel. Their hands fall asleep while driving or riding or working at the computer. Share with us, if you will, for just a moment, something about carpal tunnel, Kim.
Well, carpal tunnel syndrome is a condition where there's entrapment of your median nerve as it comes through your wrist. And a lot of times that means that you may notice that at night when you're trying to sleep, you're awakened with your hand asleep. You have pain during the night. When you wake up in the morning, it takes a while for the feeling to come back in your hand. Or when, like you said, when you're doing things like driving or typing, you notice that your hands fall asleep.
Well, I know that I've been in the surgical center next door, and I've seen the surgeons perform surgery for a carpal tunnel, and it's very, very interesting. And then I've seen the patient come right here to Georgia Rehabilitation Center and experience rehab. April, tell us or show us some of the process of the rehabilitation of carpal tunnel.
Okay, basically what happens is the surgeon goes in and releases what transfers carpal ligament right into the carpal tunnel. And when they come in, it's usually about seven days later, maybe 14. It just depends on how well the surgery went. But we teach the patient how to do massage to that area over the scar.
Okay, demonstrate that for us for just a moment.
Well, basically what we do is, as long as the sutures have been removed, we will teach them how to go in circular motions along the scar. They'll also be taught how to pinch along the scar to help mobilize the scar. And then we teach them stretches and tendon gliding exercises. So we basically get them set up and prepared for a home program.
Okay, following the surgical procedure, how long does it take to get the patient back out using that hand again free from pain?
Well, everyone is different, first of all. So that could range anywhere from 8 weeks to 4 months. It just depends on the patient and what type of occupation they had and what they're trying to get back to. But it's a very painless process. It just takes dedication.
April mentioned something that's very important that I want to focus on just a minute. And she talked about the patient's involvement. And as I've been associated with you outstanding professionals here at Georgia Rehab, I know you focus on the patient and the patient's involvement. Kim, how important is it for the patient to be involved in their own therapy and to follow through with the plan that you give them, not only here, but the plan that you give them at home? How important is patient cooperation in the therapeutic process?
Well, it's extremely important. It's basically going to make or break the patient's recovery. A lot of times with carpal tunnel syndrome, prior to having surgery, the most important thing is the home exercise program. There's only so much that can be done in the clinic. It's more showing the patient how to treat themselves at home, and a lot of that is through Neuro Mobilization, which is a technique that mobilizes the nerves themselves, not just the muscles, not just the tendons, but mobilizing the nervous system. And that's extremely important in treating any type of a nervous system condition such as carpal tunnel. And those are exercises that a therapist must teach the patient. It's not something the patient can just read about and do, but it's important for the patient to continue that at home in order for the condition to improve.
You're not only a therapist, but you're also a teacher.
Yes, right.
You teach the patient how to take control of their own therapy.
That's right.
And that's very important, isn't it?
That's right.
Let's talk now, Kim and April, about tendon injuries.
Mm-hmm. Well, we treat tendon injuries predominantly in the hand, but you can also have a tendon injury in your wrist or elbow. And usually it's from either a laceration to the tendon where someone actually cuts the tendon, or it's from a rupture where they could be aggressively gripping something and it could cause the tendon to rupture. And in either case, the patient has to undergo surgery for the tendon to be repaired, and then they come to us for therapy afterwards, because it's a long process to get that hand or the elbow or wrist back to complete function.
Well, I'm going to be very personal for just a moment. Okay? I had a tendon injury in my arm, and I went to a surgeon, and they thought about operating. In fact, they had already scheduled the operation. And then the surgeon said, before we go to surgery, here's what I want you to do. I want you to go to Georgia Rehabilitation, and I want you to go through some therapy. I was cranking my lawnmower and tore a tendon in my arm. And the therapist that I was assigned to was a lady by the name of April Johnson. And I spent some time with her, and you did a great job. Now, I want you to share with our viewing audience how you treated my problem.
Well, thank you for the compliment. First of all, there was a partial tear in the tendon, and what we did was we focused on protecting the tendon at the biceps because we didn't want to put too much stress on it, so we focused on strengthening through the triceps. So all the muscles on the back of the arm, we did the exercises, as you recall, where you did the strengthening.
I did.
And you let it pull you back up into flexion, but you were able to extend and strengthen through the backside.
Now I want you to show our viewing audience how we did that. Okay, just like, all right, I'm here as your patient now, and I want you to show them something of that therapy. Okay.
Okay, as you recall, like when I would push you passively, just relax. I would push you passively up into flexion, but I would have you extend into extension, pushing against my hand with resistance.
All right.
So you would push down. Good, and then I would push you back up passively because we didn't want to put too much tension on the tendon. We didn't want to risk the chance of actually tearing the tendon completely. And you did really well with that program. You healed and you were able to return to your activities.
Well, April, I did well because you did great.
Thank you.
And I didn't have to go to Columbus. I didn't have to drive all the way into Atlanta. Right here at Georgia Rehab, I got the finest therapy a person could receive anywhere. And guess what?
What?
I didn't have to have surgery. I was rehabilitated right here at the Georgia Rehab, and it was because of the gifts that you people have and the willingness that you have to use those to enable all of us that come here as your patients to have a better quality of life. Any other comments about tendon injuries?
Yes, actually. One of the important things that we do as therapists, especially in OT, is we have to fabricate splints to help a tendon recover. And in your case, you didn't have to have a specialized splint, but a lot of times you do, and it's the type of splint that we have featured on another show where it's designed to protect the tendon and allow the patient to exercise and move within the splint. And that's one of the things that we specialize in, is fabrication of those splints.
Okay. I know that A lot of people come here that are receiving therapy or going to receive therapy from broken, fractured bones, to the fingers, the upper arm. Share with us a little bit about the type of therapy that you would use in giving that person the therapy that they needed for a fracture in the arm or hand.
Well, depending on the fracture and where it's located, in the wrist, we tend to go ahead and begin range of motion right away because they're stiff, so we have to begin moving them. And a lot of times what we do is we just focus on, if I can demonstrate on this wrist, please, but we'll basically focus on getting them stretched in all different planes. So we would stretch the hand into extension, and we would stretch the hand into flexion. We would stretch into ulnar deviation and radial deviation. A lot of times they have problems getting the supination and pronation when they've had distal radius fractures. That's another
now
fracture.
Explain that to us.
That's another fracture.
That's one of those long medical words you're using on me, April. Explain it.
Well, just a fracture in your big bone right here, basically, okay, down closer to the wrist. And what we would do is we would teach them how to do these exercises. Our main thing is we want to get the patient restored back to function, but we also want to educate them on their home program. So we will teach them how to stretch, how to get everything stretched out, how to do some of the neurodynamics that Kim mentioned for the tendon injuries, because neurodynamics, mobilizing the nerve, is still important, and also strengthening.
I know that, and I'm glad, in a few weeks it'll be the spring of the year. And when springtime comes, there are more golfers on the golf course, and there'll be people on the tennis courts, and then there will be golfers and tennis players visiting Georgia Rehabilitation. And they will be suffering from tennis elbow and golfer's elbow, and they'll come in and they will say, how long is it going to be before I can play tennis again? Or how long is it going to be before I can hit the golf ball again? That's the first question they always ask you. And they come in with a lot of pain. A lot of pain with tennis elbow and with golfer's elbow. Tell us a little bit about the treatment for that very prevalent. It's a very prevalent injury because I have a lot of friends who play golf and a lot of friends who play tennis, and they visit. Look, you know, isn't it exciting? They don't have to go to Atlanta. They don't have to go to Columbus. They can come to the very best. And we have people from Columbus, and we have people from Atlanta, and we have people from South Georgia. We have people from all over the place coming right here to Georgia Rehabilitation for treatment.
Right.
So tell us how you treat these folks who come in with golfer's elbow and tennis, or what happens to us? What gives us the golfer's elbow or tennis elbow? Share that with us first, Kim.
Well, the conditions are actually a form of tendonitis in your elbow. And it's either, if it's an extensor injury, that's your tennis elbow. If it's a flexor injury, it's your golfer's elbow.
Now listen, we're going to get a little technical. We hear a lot today about tendonitis. Tell us, explain tendonitis. Is that just the inflammation of the tendon? Is that tendonitis?
Usually what happens is you have a little micro injury to the tendon, whether it's just a small tear or a larger tear. But you do have an inflammatory response from the injury. It's not always just inflammation though, because what people don't know is when the injury becomes chronic and they have it over a long period of time, you actually get little fibrous changes in the tendon itself. And those are the patients where it's not just an issue of swelling, it's constant pain when they try to just do something as simple as lifting a coffee cup. And the biggest thing is we get patients with that kind of a diagnosis, they've never played golf or tennis. It's just more prevalent for those people. That's how it got its name. But one of the biggest things we do with them as well is teach a home program, because the exercises they do at home, the stretches, the massage that they do is going to help to improve their condition.
So the therapy really almost never ends.
That's right.
Here at Georgia Rehab. It goes home.
It goes home, because what you learn to do here, you have to do at home in order to get better.
Okay, well, let's talk about another diagnosis, and that is the trigger finger.
Okay.
Explain that to us.
Trigger finger basically is when it catches. For instance, if a person was going to close their hand and when they came back into extension, but the finger feel like it's getting hung, like some people will say, and they have to take the other hand and physically push it, that is what the trigger finger is. So it's just another form of tendonitis inside of the finger. And I think when they got that is pulling the trigger.
Right,
So,
right.
henceforth the name trigger finger.
Do you see much of this?
Yes, we do. It's just another repetitive injury, and it comes with teaching the patient, again, the home program, ADL modification, meaning they need to modify some of their activities. We put it in the splint to rest the finger. We educate them on energy conservation and joint protection techniques. So there's a lot of, just a lot of resting with it.
Well, we're reaching the conclusion of the first part of our program, but we're going to extend it a little bit. Because I know there's a lot of interest in what we're talking about today, because so many people out there suffer from these types of injuries. I see a lot of people come through here with arthritic conditions in their wrist, in their hands, in their elbows. Take just a moment, if you will, Kim, and tell us about the treatment of arthritic conditions, because that's very prevalent among so many people today.
Well, with an arthritic patient, the biggest thing is going to be teaching them to manage their pain at home, help to reduce the swelling in the joints, exercise the joints within their limitations, but most importantly, teaching them energy conservation and joint protection techniques to keep from hurting the joints further in the future. Sometimes we do have to split the patients to allow the joints to heal, to rest. We also will treat the patients after they've had surgeries to correct arthritic joints, most commonly in the thumb.
Right. Before we go on our break, let me take just a moment and share with you something very, very important. As I have had conversation with these two outstanding professionals today, you have learned how important it is to have a professional like Kim Shulman and a professional like April Johnson taking care of you. When you need therapy, you want to come to the best. And the best advertisement we have that goes forth from Georgia Rehabilitation: the patient. We have some of the finest patients in all the world, and they come to us from many, many different sections of this state. And I would also share with you that I met patients from Arizona, I met patients from New York. They have been referred to Georgia Rehabilitation, and in a few moments you're going to meet one of those very, very special patients, and you're going to meet that person and see the therapy actually performed.
Now we are joined with a current patient of ours that we've been treating for a while in occupational therapy. This is Pamela Burris, and she had a flexor tendon injury to her right hand, and I'm going to let her give a little description of exactly how she hurt herself.
Actually, my whole thing with the summit started with urgent care, then surgery, but what happened was I was picking up a can of tuna, which a lot of you have probably done before, and when I picked up the can, the lid actually cut through both of my flexor tendons in my pinky. So I came into urgent care, and they immediately sent me to surgery the next day, and then after my surgery was over, I came to Georgia Rehabilitation and met with Kim and April, and they started my therapy for my finger.
Now, initially, this is not the type of splint that she was in. She actually had a big bulky splint on her hand, and what we did was we fabricated a specialized splint to protect her tendon and keep her hand in a flexed position, and use rubber bands to allow her to be able to exercise the tendon without putting too much stress on it. And then as we progressed, she's moved into a smaller splint just to help her stretch out the finger and keep her mobility going. Pam had a lot of let's take your splint off. She likes to call this her cricket.
It's one of my favorite things.
As you can see, Pam has really good range of motion now. Make a fist. Straighten out your finger. A lot of times after a flexor tendon injury, and a flexor tendon is the tendon on the bottom side of your palm, which allows you to bend your fingers. When you cut those tendons, you lose the ability to bend. So what happens is the doctor goes in, repairs the tendon. We put you in a splint that will bend your tendon for you, and then she could straighten her finger out. But in the process, scar tissue develops on that side of the finger where she had surgery, and it becomes thick and restricts her mobility. So in the process of doing her therapy, we had to work a lot on her scar tissue to allow that finger to be able to stretch back out once the tendon was safe to do so. And that's one of the reasons that she went into her little cricket splint, was to stretch that scar tissue out.
And this was a really important injury for me because I'm actually a web designer, so typing on the computer is my job. So when I cut my finger and I had my cast on and then my splint, it was really important for me to continue to do the therapy at home with the exercises that they gave me, and keep that up so that I could have mobility back in my pinky and I could type with it again, which I can now thanks to these lovely ladies.
I think it's also important to mention that when initially Pam came in, we placed her in the dorsal hood splint that Kim mentioned, but also she was in this hood for approximately 6 weeks. And she had to make sure that she wore this splint at all times for protection of the tendon so she didn't re-injure it. Because the tendon does go through a process where it can be re-injured 2 to 3 weeks after the surgery. So we would like to make sure that she continued to wear this splint at all times and follow all the tendon precautions. She did really well. She's doing really well. Like she said, she has returned to a lot of her activities on the computer, but we dealt with the problem after she came out of the splint for 6 weeks. You recall that you had that contracture, about a 30 degree, 15 to 20 degree, flexor contracture, So basically it was stuck in this position. And what we did was we began to stretch and mobilize in this PIP joint to try to get it straightened out, but she continued to have a little residual straighten all the way up, and that is so much better.
Oh yeah, it's a ton better.
So when we put her into the dynamic extension splint that she calls her cricket, it actually puts force right over the PIP joint, so it keeps her in an extended position. And she doesn't have to wear it all the time. How much do you wear it now?
I usually just wear it at night for a little bit, and throughout the day I'll just use it to exercise because that I am still trying to get the mobility back in the very tip end of my pinky. But it's great for that, and it's great for continuing to straighten it out. So I just usually wear it about 20 minutes at a time, only about once or twice a day.
Great.
Just to keep that up.
Great.
And about how long were you unable to work because of the injury to your hand?
Well, initially I had no idea how long it was going to take, but I ended up being in the cast for about 8 weeks, and then the splint, the hood splint, like this for about 6 weeks. So it was about 2.5 months total, and I had to learn to type with one hand. So I was very appreciative to have Georgia Rehabilitation literally right down the street from my house. I didn't have to travel to Atlanta. I'm originally from Gwinnett County, so my mental state, I was just thinking, okay, I have to go back to Atlanta. I'd heard of the summit. I came here for urgent care. I came here for the surgery, and then Georgia Rehabilitation was right here. So it was really awesome to have it this close, especially having to come once a week. It just made it very convenient for me and for my job to be real close. And you can't get better therapists than this. I'm telling you, they're not only physical therapy, they're mental therapy too. We have a lot of fun, so.
We won't talk about it. All right.
Well, actually, I'm glad you mentioned that we do treat the whole person, the mind, the body, the soul. I'm glad you mentioned that because it's important, because when a person goes through an injury, as you realize, it is a loss. And when you have that loss, you're not able to do what you're used to doing.
Right.
And so you feel like, oh, this is it, I can't do this, I can't do that. But you had such a positive attitude, and that made the therapy so much better. It made for a smoother transition for your recovery. And we like to say how great of a patient you are.
Well, thank you. I appreciate that.
Pam encourages other patients that are just getting started in therapy. She comes in now that she's close to the end of her therapy, and she's always like, oh, I remember when my finger wouldn't do that either, but see, it does it now. And she tries to be a motivator for everyone else, so they all love Pam.
Well, just being in the splint for so long and my hand was like this, I didn't have range of my wrist either, so it does affect more than just the part where you have surgery. It affects your whole hand, and after my splint came off, they did have to work with the mobility of my wrist, and I couldn't bend further back than this, and now I have full range again. So it's great. They really did a great job, and like I said, being a web designer, it is very crucial for me to be able to type with both hands and to have that mobility, and it's been fantastic, and I feel whole again. So they did a great job.
Wonderful.
Wonderful.
What about some of the activities that you had to do? Remember in therapy, some of the activities that we had you doing that seems a little off the wall, but can you just kind of go into that?
Well, when you walk into Georgia Rehabilitation, you see, it's almost like seeing toys everywhere, and I had no idea what toys I was going to be playing with, but they have me working on clothespins where I actually can take the clothespins and pick them up with my pinky now, which before I couldn't do that because I had no strength in it. I open the clothespins, put them down, then put them back on, and there's different levels of hardness for the clothespins. They also have putty, which is great. It has little buttons in it, and I find the buttons in the putty, so that's a lot of fun. And then just the massage, the paraffin wax, dipping my hand to heat it up, which I actually have a paraffin bath at home now that I can use just to soothe my hand. So that's it's a really great learning experience. And even I find myself when I was helping my friend move, she had clothespins somewhere, and instead of just grabbing them with my fingers, I actually grabbed them with my pinky to continue that therapy. So you learn a lot of stuff here.
Great. And I mean, and the thing of it is that we're really focused on that fine motor coordination and also the manipulation. And a lot of people think it's just activities and things that we're doing, but we're trying to incorporate into your daily activities. And you found that you were able to do that also.
Absolutely.
Thank you for tuning in today, and I do want to mention that you don't have to be referred to us by a doctor here in the local area. We get referrals from doctors in Atlanta, Columbus, even outside of the state. So if you're seeing a physician elsewhere and you want to come to therapy closer to home, feel free to come and see us. We can take care of whatever needs you have. We appreciate you joining us on A View from the Summit, and keep in mind, as Dr. Tyra would say, you are in control of your healthcare destiny. Come see us anytime you need to.